Joining me live right now, Sports Medicine Center, Akron Children's Hospital, my good friend, Dr. Joe Congini. Joe, good morning. Thanks for joining us again.
Hi, Ray. How you doing this morning?
I'm doing terrific. How about you?
I'm doing good. Getting near the holidays here. It's a fun time of year and a lot of festive things going on. But in the world of sports, Ray, there are some things going on, some trends that aren't so great, and a lot of injuries going on in the end of fall season for our high school kids, college kids, and especially we look sometimes to the pros to get a sense. Boy, Ray, look at all the quarterbacks that have gone down in just the last 2 or 3 weeks. I mean, unbelievable. Kyler Murray, Mariota, 2 quarterbacks in Baltimore, 2 quarterbacks in the L.A. Rams, 3 quarterbacks in San Francisco. There's quarterbacks all over the place going down. But, of course, the injury that's concerning to us is that the concussions have really reared their ugly head in the professional ranks, in the quarterback ranks, and in the high school ranks. We really saw a big spike in the months of November and December. And here we were, I remember on your show a couple months ago, kind of patting ourselves on the back that the way we look at these injuries over time, we have a relatively new way of tracking these called Healthy Roster. Looked like we had less injuries overall, less concussions overall, but now it seems like, wow, those are really rising. And one of the theories behind it, Ray, and I just want your audience to know that, and you particularly, because you're such a good thinker, you're around sports so much, is are these concussions, are they cumulative in nature? In other words, do they add up over the course of time, over the course of a game, over the course of a week, over the course of a month, several months? Are there these what are called, sorry about using them fancy medical words, sub-concussive blows that are hits to the head that are just below the level of causing a concussion? But these sub-concussive blows, do they kind of add up as the season goes on and there's a cumulative effect? And I would say most people in sports medicine that I know really believe there is a cumulative effect phenomenon that goes on with concussions. And so that's really concerning. There is some evidence here, so we always, want to point to the research, as I tell you. And I looked back over some of the research from a couple of years ago. Actually, pre-COVID, there were some good studies where they, you might remember back, I would talk about sometimes, they put these small accelerometers in the helmet of certain athletes and follow them. And these are devices that actually measure the G-forces of a hit or the impact of a hit or what a blow to the brain, the impact of that blow to the brain, and kind of trying to see does it accumulate over time. And so there seemed to be no doubt about it that there is some cumulative effect, and what can we do about it? And one of the groups that's really involved in concussion care for younger athletes particularly is called the Concussion Legacy Foundation, and they really have tried to come up with a couple of guidelines of things that we ought to do about that. They really, number one, talk about delaying the introduction of contact sports for kids. And again, that's not always just football, but delaying that. They also talked about avoiding unnecessary head contact, and I know that we've done a lot of things with changing some of the drills and so forth to protect the head. And they also, number 3, talk about modifying contact when possible. In other words, if you have to teach a skill in a sport, but it may cause somebody to have an impact to the head, really limit the amount you need to do in that drill to the very minimum to teach that skill to the athlete. A newer thing that came out in the last couple of years are these mushroom caps that people wear in camp. In training camp. Nobody was wearing them in competition now, but in the sport of football, I don't know if you've seen these larger padded caps called mushroom caps to try to reduce the blow to the head while people are practicing. And so, a lot of questions remain in this area of, is there cumulative effect? Do they add up over time? How much rest between hits would allow the brain to go back to acting normally again? How many hits does an athlete have to take over time before they really become on the edge of these sub-concussive hits that suppress brain function? And so we don't, of course, know the answers to those things. But one other thing that is going on in sports medicine now is the call to, hey, maybe we ought to design helmets with these accelerometers in them so we know if athletes are getting near whatever that magic number of G-forces is, and try to rest them at a period of time before they would get to where they would go over into a clinical concussion. There's some evidence even from this Concussion Legacy Foundation that subconcussive blows may be more of a risk for the long-term effects like CTE than even multiple concussions are. So there's a lot of things that are a little bit frightening about it. We were sitting up there a couple of months ago, I remember even on the show talking about, hey, we're really looking like the numbers are pretty good right now. And we have an awful lot of concussions that have come in over the last couple of months. So we're not done with this problem. We have a lot to figure out yet. And I think there's a lot of questions that revolve around this issue of these subconcussive blows and how many of those put a person at risk for then going over into a clinical concussion.
All right. Great information again, Joe. Spot on, man, with all the research and the work that you do into this world of the concussions. You've done it for many years, and many, many people the better for it. Thanks for the time this morning.
Thanks, Ray. Have a great rest of the week.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital with us.